You are staring at another negative test, month 12, month 18, maybe month 30. And everyone keeps saying, just relax. Stop stressing about it. As if your body failing to do what it is supposed to do is just a mindset problem. Here is the lie. Infertility is a medical issue you solve with the right doctor and treatment plan. But that is not the whole truth. Infertility is an emotional crisis that tears apart your sense of self, destroys relationships, and steals the future you planned. It is chronic grief with no funeral. Trauma that nobody acknowledges. Today we're talking about what infertility actually does to you, the grief that never stops, the isolation that suffocates you, the treatment hell that breaks you down, and why nobody prepared you for any of this. This is not one loss. It is 1,000 tiny deaths. Every month your period shows up, you lose that hope again. Every due date that passes for a pregnancy that never happened, you grieve a ghost. Every birthday, every holiday, every milestone you imagined, it is all loss. And while everyone else's life keeps moving forward, yours feels frozen. Up to 40% of women going through fertility treatment have diagnosable anxiety or depression, comparable to cancer patients. This is not just feeling sad. It is your brain stuck in chronic fight or flight mode. The constant stress wrecks your sleep, destroys your focus at work, and makes basic functioning impossible. You track everything obsessively. Cycle days, ovulation windows, symptom spotting during the 2-week wait. Every twinge, every cramp becomes something you analyze. You know exactly how many days late your period is, how many cycles you have tried. The numbers haunt you. Every negative test is confirmation that your body failed you again. You start bargaining with the universe. If I just eat cleaner, exercise more, stress less, pray harder, maybe this month will be different. You read every success story online, searching for the magic formula someone else used. You spend hours on fertility forums at 2 a.m., comparing symptoms, looking for hope in other people's experiences. The obsession takes over your life because it is the only thing that makes you feel like you have any control. Then there is the shame. You feel like a failure as something your body is supposed to do automatically. Your sense of femininity gets tangled up with your ability to conceive, and when you cannot, it feels like you are less than. Like you have let down your partner, your family, everyone who expected this from you. You internalize a medical problem as a personal defect. The worst part? This grief is invisible. Society does not recognize infertility as a legitimate loss because there is no person to mourn. No funeral, no bereavement leave from work. You are expected to keep showing up, keep smiling, keep functioning. You are grieving something that never existed, and that makes it impossible to explain. So you carry it alone, in silence. This invisible grief gets worse when you are forced to navigate a world that will not stop celebrating pregnancy. You feel completely alone even when you are surrounded by people. There is a stigma with infertility, like you are incomplete because you do not have children. You feel like the only person struggling while everyone else gets pregnant by accident. And you cannot talk about it. Because when you do, people hit you with toxic positivity or useless advice. The triggers are everywhere. Baby showers you decline because you will break down. Pregnancy announcements that feel like a punch to the chest. Your social media feed is ultrasound photos and gender reveals. Family members asking, when are you having kids? Like it is casual small talk. Mother's Day, baby commercials. Every day, something reminds you of what you do not have. Work becomes another minefield. Coworkers announce pregnancies and you have to congratulate them while dying inside. Someone brings their newborn to the office, and everyone gathers around cooing while you hide in the bathroom. You are expected to contribute to baby shower gifts for people you barely know. Meanwhile, you are sneaking out for fertility appointments, lying about why you need time off, terrified someone will ask questions you are not ready to answer. Then there is the advice that makes everything worse. Just relax and it will happen. As if stress is the problem and not the actual medical condition. Have you tried acupuncture? Cutting out gluten? Standing on your head after sex? Yes, you have tried everything. At least you can sleep in and travel, right? Because that is a fair trade for the family you desperately want. Maybe it is not meant to be. That one is a knife. And the classic, you can always adopt. As if adoption is some simple backup plan you have not already agonized over. Your relationships crack under the pressure. Sex becomes a clinical task tied to ovulation schedules. You and your partner grieve differently, and sometimes you cannot support each other because you are both drowning. Even with male factor infertility, the burden falls hardest on women. You are doing the treatments, taking the medications, enduring the procedures. Resentment builds. About 50% of couples report their relationship deteriorated during fertility treatment. You feel jealous of people you love. Your sister announces she is pregnant with her third, and instead of joy, you feel rage. Your best friend complains about morning sickness, and you want to scream that you would give anything to feel that sick. You hate yourself for it. But infertility turns you into someone you do not recognize. Someone who cannot be happy for other people is good news. So you withdraw. You avoid friends with kids because being around them hurts. You decline invitations because you cannot fake happiness anymore. Everyone in your life is moving forward while you are stuck in this endless loop. The loneliness becomes unbearable. You are isolated not just from other people, but from the life you thought you would be living. And when you finally decide to pursue treatment, thinking maybe this will be the answer, you discover it comes with its own special kind of hell. The physical reality of fertility treatment is brutal. Daily injections that leave bruises across your stomach and thighs. Constant blood draws and transvaginal ultrasounds, sometimes multiple times per week. Invasive procedures that require sedation and recovery time. Hormonal medications that make you bloated, moody, uncomfortable. Your ovaries swell to the size of grapefruits during stimulation. You feel every twinge, every pull. If you are doing IVF, there is egg retrieval, a surgical procedure where they extract your eggs while you are under anesthesia. Then you wait for the call about how many fertilized, how many made it to day 3, day 5. Each phone call brings another potential loss. Then there is embryo transfer, where they place an embryo back inside you and tell you to go home and wait. 2 weeks of limbo where you are technically pregnant, but have no idea if it is actually working. Your body does not feel like yours anymore. It is a science experiment with no guarantee of results. The emotional roller coaster is worse than the physical pain. Every cycle starts with hope. This time will work. This time you will finally get your positive test. And then it does not work, and you are devastated all over again. You are constantly waiting and waiting for test results, waiting for beta numbers, waiting for ultrasound confirmation that there is actually a heartbeat. You are terrified you are running out of time, running out of money, running out of emotional reserves to keep trying. Each failed cycle chips away at your ability to hope. The first few times, you bounce back. You tell yourself it just was not the right time, that next month will be better. But after months or years, hope feels dangerous. You are afraid to believe it might work because the crash when it does not is unbearable. You stop telling people when you are in a cycle because you cannot handle their hopeful questions or their pity when it fails. You exist in limbo, going through the motions while protecting yourself from caring too much. Numb and desperate at the same time. The uncertainty is paralyzing. You do not know if you should keep your current job or take that promotion. You do not know if you should plan that trip or save the money for another treatment cycle. Your entire life is on hold, waiting for something that might never happen. You are stuck between moving forward and staying frozen, and both choices feel wrong. Then there is the financial nightmare. Tens of thousands of dollars with no guarantee. You are constantly doing the math, figuring out how much more you can afford. You feel guilty spending this much on something that might never work, but you are trapped. You cannot afford to keep going, but you cannot afford to stop and always wonder what if. You lose all control. Everything revolves around appointments, medication schedules, treatment protocols. You cannot plan a vacation or make a career move because your timeline is unpredictable. Your body, your future, your choices, none of it belongs to you anymore. Nobody can tell you when to stop. You are terrified of giving up too soon and wondering if one more cycle would have worked. But you are also terrified of continuing too long and losing yourself completely. There is no right answer. Just impossible choices nobody prepared you to make. So where does that leave you? Your grief is real, your pain is valid. Your struggle deserves to be seen. Infertility is a legitimate trauma that destroys lives, and it is time we started acknowledging that. This is not just a medical problem. It is an emotional crisis that needs real support. Here is what actually helps. Find a therapist who specializes in infertility. Look for someone certified through organizations like the American Society for Reproductive Medicine. Join Resolve, the National Infertility Association, or find online communities like the Infertility subreddit, where thousands of people understand exactly what you are going through. If you are doing IVF, connect with local support groups through your clinic or through Fertility IQ. These are not just nice-to-haves, they are lifelines. And hear this, you are not defined by your ability to conceive. Your worth as a woman, as a partner, as a human being is not tied to your fertility. You are not broken. If this resonated with you, share it with someone who needs to hear it. Subscribe for more honest conversations about women's health that nobody else is having.